الكاميرا حلصق فيجي شويه.
اعطيني تشو بليز.
انزين ليش حاطين تشو كذي؟
ها ترى احنا قاعد نسمع. قاعد نسمع ترى.
خراتي.
عنود دني شويه تقول.
ايه بس يا تسمعينها؟
ايه ابي اقعد هني ما يصير؟
الله صدق انت طماشه عماد.
شكلي بقعد هني. اوكي. وين اقعد؟ حطيني خل اشوف.
الكاميرات كنا تغير شكلها.
كسروا.
وهذا صغار كل شيء قام صغار. بنات اصلي يصير اصوركم لان شكلكم كيوت وانتم ماتشي.
حلال.
هلا. اي انا قاعده اتكلم الحين بس قاعده اصورهم شكلهم كيوت لابسين تايجر مع بعض. شلون اسوي زوم؟ تكلمي عنود.
السلام عليكم. 1 2 3 4 1 2 3 4 5 6.
مهذبة عنود. يلا بنات ضحكة يلا 1 2 3.
هلا واحد. لا في دكتور بطل ما تكلم شوي.
انزين اوكي 1 2 3 4 5 6 7 8 9 10 مليون مليونين 3 ملايين.
ان شاء الله الحين اتكلم. مشغولة بالانستغرام. اي اتس اوكي. قاعدة تهوني لاني قاعدة اسوي انستغرام. صوت الضيف ايه تفضل يا دكتورة.
1 2 3 4 5 6 7 8.
تمام صوت الدكتورة. اوكي. اي انا اوكي. كلنا اوكي الحمد لله رب العالمين.
Good evening, ladies and gentlemen. Thanks for watching us today on KTV2 on the Healthy Life Show. I'm Dr. ANOUD JUWAIHEL, a family physician. I'll be grateful today to carry this show with you and with my colleague, Dr. Noor.
Hello everyone, I hope everybody had a nice weekend. I'm Dr. NEBARI, a family physician. Tonight we have a very special guest and a very important topic for all mothers and fathers. You have to be watching this. So if you have any questions for us during the show, just call us on the following numbers or you can mention us on Twitter as well. And here are the numbers. Welcome back. Today we have a special report and it's about the opening ceremony of the Hayat Center Early Detection of Breast Cancer, and that's with the attendance of His Excellency the Minister of Health himself, and it was in Abdul Hadi Center in Yarmouk. So here is the report.
Pleasure and honor today that I was present at the inauguration of the Hayat breast screening facility, the first of its kind in Kuwait, built on a partnership between the public and private sector. All my thanks, my heartfelt thanks go out to all the private sector entities that were very generous in what they offered this one-of-a-kind center in Kuwait that will reach out to contact women over 40 and arrange for screenings for them here free of charge in order to catch breast cancer at an early stage and to treat it at an early stage. I hope this type of engagement will also encourage other generous private sector entities to increase their social responsibility within the country, and that we have the ability to open more of these type of centers and other types of centers in the future. Thanks for being here, and we hope to meet with you soon.
I come from a company from Finland, a company called Commit. I'm the managing director, Markku Myllylä, and we have provided here high technology from Europe, modern IT systems that increase the quality of work of the screening center. And it connects to the high quality equipment, digital mammography units and ultrasound units that are also high technology equipment. These are very highly usable and user-friendly equipment. Plus also with the modern IT system we are practically removing paper and pen, so people don't want to have to lose data by losing papers.
Dr. Huda Al-Dwaisan. I am a consultant in family medicine, RCGPF, and I am the head of this center. In our Yarmouk Center considered to be one of the best center in Kuwait because it has a lot of services for the patient, and these services can be divided into general services and specialized services. The general services which is the family medicine and general practice outpatients, and the specialized centers or services are the diabetic or chronic diseases clinic, the osteoporosis clinic, the obesity clinic, the bronchial asthma clinic, the psychiatric clinic, the well baby clinic, and the prevention and screening program clinic in this department. And also we have the service of the lab and the x-ray, the dentist, and a very good pharmacy.
Welcome back, dear viewers. I would like to congratulate Dr. Huda Dwaisan for her success and beautiful works in Yarmouk Clinic with regard to breast screening. I wish her all the best, and I wish all the success for her. Now we're going to move to our best part of the show. We're going to have a very interesting talk today and an interesting show. We're going to have a meeting with a pediatric emergency specialist and toxicologist, Dr. Fatuma Al-Abdurazzaq, and I think this is a very, very important show for all parents who have kids, because she will give us a lot of information on how to take care of our kids. So thanks again, Dr. Fatuma, for this lovely interview.
My pleasure to be with you here today, Dr. ANOUD and Dr. Noor.
Thanks a lot. Dr. Fatuma, you know that you notice now at this times there is a lot of kids going on to the clinics and hospitals, and there is a lot of rise in the incidence of fevers and the flus. You know, this is a really big week. We have a busy clinic nowadays. As you notice, like, fever is the most common presentation nowadays. Sometimes it is quite, a very simple presentation that will just take a few days and it will go, but sometimes fever can be a serious thing. So can you tell us exactly why do most of the parents really are terrified about fever, and what is the reason they are really terrified about it?
That's a very important question, Dr. ANOUD. So in regards to the fever, so there are lots of causes of fever, and parents, I would say, do not know what's the cause of the fever I would say in some cases. In most of the cases they would know that this is, for example, like an upper respiratory tract infection. It's going to take actually its period and it's going to resolve. But in other circumstances, actually, they need to go to the clinician, either in the clinic, for example, or in the pediatric emergency department to sort this out. So in terms of why I would say parents would be terrified, maybe the length of the fever, the duration itself, it must be very long for them. Very long, actually, it's different, because for some parents, very long, it would be hours and hours. For some parents, it would be days and weeks, right?
So it depends.
Exactly, it depends. The other thing that if they do have if the children do have other, I would say, symptoms and signs that would really terrify parents, for example, if they do have headaches, if kids would present with vomiting, for example. So this is really I would say one of the most important signs that the parents actually should watch for the fever. And if the fever is not decreasing, with, for example, the medications that's supposed to decrease the fever, and it's persistently high, so that's why they're terrified and they come to have a second opinion from the physician.
The thing is about fever, they're always scared of the number. Is the number gives you the severity of the disease, or it's not really related?
I would say it's not related, because sometimes you have a simple viral infection with a really high temperature, and sometimes you have like a bacterial infection with a very, I would say mild temperature. Now the thing that the sudden rise in temperature would trigger a condition that we're going to discuss later, called febrile convulsion. So I would say the number itself might not actually be like a good sign for a physician whether this is a viral or bacterial infection per se, but we have actually to take the patient's, I would say, signs and symptoms into consideration and to do our full physical examination.
Most parents, let's say, honestly, when their kids actually have a very, very high fever, let's say around 40s, and it's keeping going for a long time, they're usually terrified about brain injuries or convulsion. So can you tell us a little bit more about febrile convulsion? What is it exactly and how common it is?
So febrile convulsion is a condition that usually happens in kids between 6 months and 6 years of age. And what triggers the convulsion is the sudden rise in temperature. Like, for example, if the temperature was 37.5 or 38 Celsius, and all of a sudden it increased like up to 40 or 40 and a half or 41. So that actually changes the electricity of the brain, and it will trigger actually the movements that the parents would say. And really they are terrifying for parents. For parents, exactly. And usually the febrile convulsions usually happen in children who does have like normal, I would say, development, and who does have like normal neurological, I would say, examination. It's usually short-lived. Some of the, for example, if it's less than 5 to 10 minutes, we call it like febrile convulsion. If it lasted more than 15 minutes, it's called like prolonged convulsion with fever. And we have at that time actually to sort out like if it's related, for example, to other like infections like meningitis or encephalitis.
Or it could be due to any other brain tumors, probably the patient could have, right?
Yeah, like a brain abscess, for example, space-occupying lesion. Yeah, you're right.
Yeah.
So the febrile convulsions, like, the thing is about them, are they very common in Kuwait? Do you see them a lot, or they're not?
They are, to be honest. I've seen lots of febrile convulsions in Kuwait, and the thing that, like, for example, like the first attack of febrile convulsion would be really terrifying, and for parents, I would say, because this is the first time of seeing like the febrile, the convulsion, I would say, with the children. So parents actually would be terrified. So if febrile convulsion happened, parents need to make sure that the patient is breathing first of all, right?
Yeah.
Like rather than putting like a wet cloth, for example, like, or a dry cloth in their mouth, they have actually to keep them in the side. So if there is like secretions, vomitus, for example, all of that actually will go into the side rather than the child aspirating that. And we can discuss, like, if you want, for example, like what to do, like for the parents, what to do at home too.
Okay. And does it run in the family?
Febrile convulsions?
Yeah.
So some of them actually would have a family history of febrile convulsions. Like if we ask, for example, some of the parents, some of the like far relatives or even like near relatives would have like they would have like a febrile seizure. Yeah.
Should a parent worry that a single febrile convulsion can lead to, for example, more febrile convulsions or even serious, more serious result like
Or
epilepsy?
yeah.
So
That's another important point. I actually have lots of questions from parents in regards to that. So the febrile convulsion actually can recur, and it can recur in the first 24 hours, and it can occur after. It can recur like in few weeks, for example, or even like in the next few days, or in the next month, for example, or so. So it can recur. In regards to the epilepsy, so there is a 1 to 2% chance of that febrile convulsion to have like an epileptoid, I would say, future. But I think that the febrile convulsion per se is a benign condition, and usually it's resolved, usually by 6 years of age. And like the treatment for that is usually just to decrease the temperature and to treat the condition that led into the fever.
it must be a very scary experience for parents, like to see their children just, moving a very straight motion, and usually they don't know what to do.
Yes.
So what is the first thing parents should do if they see their child seizing?
So as I said initially, they need actually to make sure that the child is breathing. So make sure that the child is breathing, and of course, like the child would be unconscious and he would have like those movements, for example. So first of all, turn the child into the left side and make sure that, like if there's vomitus, for example, just to keep them on the side for to prevent like the aspiration. The other thing that if, for example, the febrile seizure had lasted more than 5 minutes, so they should call the parents actually should call the ambulance for that and try to decrease the temperature, and they have actually to bring the child right away into the emergency department or to the nearest, I would say, healthcare facility.
Once again, we said this is very terrifying situations. Once the parents see the occasion when their kids are convulsing, you know, they always say to you again, how can I prevent this from happening? Is there any certain medication that I have to put my kids on daily to prevent this happening, you know? What do you respond to them?
So in regards actually to this question, so it's important to decrease the temperature, because as I said before, the sudden rise in the temperature would trigger the seizure. So once the child has a fever, to give the medication like the acetaminophen or the ibuprofen to decrease the temperature depending on the severity of the fever. And in regards to the prevention, I wouldn't actually recommend any other like medication other than those medications to control the febrile
Even if
seizure.
it's more than 2 occasions that's happening,
In
let's
the
say,
same day, you mean?
not in the same day, say for example in the same 1 month, like they have maybe 2 or 3 occasions, would you recommend to put them on anti-epileptic medications?
I wouldn't actually put them on any anti-epileptic medication. I would actually leave it to the pediatric neurologist opinion if it's, for example, recurrent. But if it's like 2 or 3 per month, I wouldn't put the patient on anti-epileptic medication. Generally, we don't put the febrile convulsion kids on anti-epileptic medication unless actually it interferes with their, for example, performance or with neurological or the developmental status for the patient.
Exactly. Now the thing is, after they have the seizure and they, you know, discharge from the hospital, what would you advise the mother to do, and what would you give them at home?
So, like in the hospital, for example, like we have to triage the patient, check their vital signs, and try actually to see what's the cause of the fever, like what triggered the fever. So usually if it's like an upper respiratory tract symptoms, for example, it's viral versus bacterial, we have to act differently with supportive like measures, for example, with just hydration and decreasing the temperature. If it's bacterial, we usually go to the antibiotic. For home, some clinician would give a medication called Valium for the parents actually to put it in their bottom. So
Yeah, do you have the pictures for that?
I have actually a picture for that. So this is usually the Valium suppository that some of the clinicians would actually have prescribed to the parents in case actually if it happens at home. I don't usually do it.
There is a lot of restriction with, you know, distributing the Valium suppository at home
Exactly.
here in our
It has like
countries.
certain side effects like respiratory depression, and children might actually have like cessation of breathing. So I wouldn't actually recommend that. The most important thing, as I said, is the hydration and to control the fever, I would say, and to treat the symptoms. The cause, I would say, for the fever. And I have actually some pictures for the diazepam that we tend to give, like we tend to inject intravenously for kids who tend to present in the emergency department once they have like the seizures. We tend actually to stop them by intravenous medication.
That's very good. To be honest, I notice a lot of parents actually in my clinic with their kids, if they have a past history of febrile convulsion, they usually insist on having antibiotics. They usually lower the threshold for prescribing antibiotic. They say, like, I'm going to be terrified my kid's going to have another episode of febrile convulsion, so please give me that antibiotic as soon as possible. So how do you respond to that?
So
do we have to lower the threshold?
Well, the thing that some of, like I would say, like, some of the febrile seizures causes wouldn't be like bacteria, so they wouldn't need antibiotic necessarily. So by giving, and it's viral, I would say, so the cause actually would be viral. So by giving antibiotic to the children, it's going to actually cause resistance to the important, I would say, and to the flora and to the bacteria, which is supposed, like which is naturally in the body, it's supposed to fight infections. So I wouldn't give antibiotic. And once actually I explain that, I will take my time and explain to the parents. Parents would appreciate actually and would understand that. And tell them actually, I usually tell them that antibiotics even is not free of side effects. Like every medication in the world has a side effect. So the antibiotics is not free of side effect. And if the patient, for example, needs an antibiotic, we have to weigh the risks and the benefits actually of having and not having specific antibiotic.
Yeah, exactly. Communication, I think, with the parents is the best way, and always, you know, getting to the solution together with the parent is actually the best way to handle these things. Another cause of fever is, of course, meningitis, and usually parents aren't aware of what is meningitis. So can you explain it to us, please?
So meningitis is actually an infection, like an infection in the meninges of the brain. So these are actually the layers that protect and covers the brain. So this is actually a serious infection, and it has actually lots of causes. So meningitis can be fungal, can be tuberculous, can be bacterial causes. And the thing that, as I said, actually it's a serious infection. Kids usually tend to present with fever. Some of them would present with a rash, a generalized kind of rash, and we call that in our medical language meningococcemia. And here is actually a picture of that. And children actually would be very toxic. They look really unwell, and some of them actually tend to have like change in the mental status. Some of them would have convulsions, and some of them actually have vomiting. Cases actually that we've seen in the hospital, I've seen like lots of cases of meningitis and encephalitis. And usually we have to interfere very quickly, like those patients needs to have like an immediate management, like in terms of antibiotics and other investigations like scans and lumbar punctures and so on.
Dr. Fatuma, we noticed there is a small outbreak of meningitis probably in the last few years because a lot of people or a lot of parents refuse to give their kids the MMR vaccines. So how do you respond to that?
So in regards to like the vaccines, I would actually recommend like parents would give like the vaccine, especially the pneumovax, the vaccines. Like initially, like before 2005, there wasn't actually like this vaccination, or it wasn't actually given to the kids. This vaccination had reduced the incidence and reduced actually, sorry, the incidence of the meningitis and encephalitis. So I would actually recommend the parents actually going with those vaccinations.
So the Ministry of Health lately have, you know, this a new, you know, way of, you know, spreading awareness of vaccinations, and they now are setting up appointments or like nurse home visits to just check the vaccination schedules of children under 3. And what do you think about that?
I think it's a good step, I would say, because we need actually to catch those parents who miss their the children's actually their children vaccination. So I think actually it's an excellent step.
Yeah, but the problem is it's just going to be 1 week. That's what I heard. Do you think it will be enough, like, to cover all the population in 1 week? I don't think it's possible, though.
Yeah, I think it's hard actually to have a week just to cover like the whole population. Have actually to wait for the results actually for that week visit to know like in terms of the results. But I think actually 1 week is a short period.
Okay, we go back a little bit to the meningitis. One of the most terrifying investigation you do in the emergency department is the lumbar punctures.
Yeah.
Every parents hate it.
Everybody's scared of the lumbar puncture. Yeah.
Even me. So, like, but how safe truly it is, like, you know, especially to be taken from kids.
That's again, Dr. ANOUD, that's a very excellent point. Like, I have daily questions in regards to the lumbar puncture. No, I don't want to actually have a lumbar puncture. Just start an antibiotic for my kid and he's going to be well. So usually I would respond by drawing a picture of the landmarks for the area actually that we tend to do the lumbar puncture in, and usually it's away from the nerves. So usually there will be no neurological decompromise for the kids and for the patients actually from the lumbar puncture. The only thing that might be, the patient actually might have like some headaches, for example, and we have actually to tell the parents in terms of the common side effects like headaches, for example, they think that they might actually have some, for example, like it depends, some pain in regards to that. So that's why Depending on the age of the kid, we tend to use some pain medications prior to the lumbar puncture. Like if they are, for example, like very young, like they are infants, we tend to use medication called EMAD. It's like a cream actually that we put on the back of the patient just to decrease the pain. And if the patient actually is older and older, we tend to give like intravenous medication, like for pain, for them actually not to feel the pain from that. But as I said, it's a safe procedure. It's beneficial for the parents and for the children and for the doctors, because we need to know like what's the cause, like, and what bacteria actually does it cause by, what's the, if it's for example a virus, because it's going to limit the medication duration, to be honest, because some bacteria actually will need like a week, others will need like 2 weeks or 3 weeks. So it's a safe procedure. Don't be afraid from that.
So can you repeat for us the signs of meningitis? Are there important signs you can mention again?
So we mentioned the fever and headache.
Yeah.
Some of them actually tend to have vomiting too. Others tend to have a decrease in the level of consciousness. Some of them would be sleepy, lethargic, refusal to drink, refusal to eat, convulsion. Some of them actually will tend to have convulsion. And in terms of the body, actually, as I said as I actually had demonstrated in the picture, some of them actually would have rash, not most of them. Some of them actually would have rash. So I would say actually, if parents had noticed such rash, to come right away to the emergency department to sort this out.
And in infants, do you have anything, for example, it's very hard to tell what infants feel like sometimes.
Absolutely.
So what do you think?
In infants, it's, they do have non-specific signs and symptoms. So infants actually, they tend to have, for example, refusal to drink. They tend to have fever, change, as I said, in the level of their awareness and consciousness. They won't be active. Some of them would be really active, like very irritable. On the other hand, actually, some of them would be very sleepy. Some of them actually tend to have vomiting too. So it's really hard in infants. So that's why actually, if you have an infant who tend to have fever, especially if they are from the 0 to 3 months of age, they need actually to be seen by a physician, a treating physician. And even if, for example, up to 36 months of age, sometimes actually you can't tell, so it's good actually for the parents to seek medical advice.
In case of meningitis haven't been treated well, is there any serious complications, especially neurological complications, that could affect the child later on?
It depends actually on the meningitis itself, the cause of the meningitis. If it's, for example, bacterial versus viral versus tuberculous, most of the viral meningitis would be
Treated by itself.
Exactly, would be fine. As I said, actually, it depends. Others tend to have, for example, neurological sequelae, as you mentioned, for example, I would say loss in their development if they are not treating well. So it depends on the parents, because sometimes actually they would have debate, I would say, the medical treatment, and they don't want the lumbar puncture, so it's hard for us actually to know. So as I said, headache, for example, hearing loss. Some of them actually tend to have hearing loss, change in the academic performance. But to be honest, me personally, I haven't actually seen any of those side effects from meningitis and from the treatment.
I got a question actually from one of the parents. I think her name is Badr. She had a question about the use of antibiotic. She said, if I give my kids an antibiotic, he will be resolved for any symptoms she didn't mention. It will be resolved for the few days, and then after maybe 5 days, maybe after 3 days, she will discontinue the antibiotic, and then the symptoms will reoccur after a few days. So she said, would there be any kind of side effect if I only give my kids the antibiotic for only two days? Would the symptoms be more aggressive later on? And that's her questions. She was asking about the duration of the antibiotic use.
So that's a good question. So if the physician would say for the parent that the duration of antibiotic is 10 days, so take it for 10 days. And I usually tell my parents, for example, or I would say the caregivers who tend to visit me, even if the fever had decreased on the 3rd or in the 4th day, just continue the course of the antibiotic, because it's beneficial. If you cut down the antibiotic, and if you stop it by yourself without seeing like a physician, you might actually, I would say, you won't actually have like the important results that you need actually to have from your kid. You won't actually have the full resolution, I would say. So it's better actually to finish the antibiotic as per physician advice.
Yes, it's a very, we've noticed that a lot of people are doing that, and it just causes a lot of problems later on. But some of them do take the antibiotics, and they worry that the antibiotics are not working within 1 or 2 days. What do you think about that?
So usually I would respond to that by saying that, okay, you need actually to take your antibiotic. You have to wait for 48 to 72 hours for the antibiotic to work, because actually it's not going to work, I would say, in a day and night. It might actually take a time for the antibiotic to work. So usually I tell the parents, you have to wait for 48 to 72 hours. If you don't see any response, meaning that if the patient still has fever, for example, if the patient has still symptoms, you need to come and visit us, and we need actually to take like further steps in the management.
This is a very nice coverage of meningitis, and thanks a lot for this nice coverage. We will move now to the urinary tract infections, especially in kids while they have fever. So they have fever and some urinary tract infection. Why this is really important issues that we should educate the parents about it, to come to the medical casualties?
Because we wanted to prevent like further recurrent, I would say, urine tract infections. Because actually it's not good to have like urine tract infection. It's going to harm the kidney, and it might actually cause like renal and kidney issues like in the future. So once actually they do have like symptoms of fever, for example, and it depends on the child, like in terms of the symptoms and the signs of the urine tract infection, as with meningitis, infants actually tend to have non-specific symptoms, and the older the child is, the symptoms and the signs actually would be clear of having, like, for example, inability to pass urine, for example, vomiting, abdominal pain. So it's important actually to come right away and to have the treatment.
Okay, so we will continue our talk, and we will have a really nice talk about gastroenteritis and what to do for your child when he's vomiting or having diarrhea. So stay tuned and don't go away.
A substance called an allergen. Common allergens include pollen, animal dander, down feathers, mites, chemicals, and a variety of foods. On first exposure, the inhaled allergen enters the mucous membrane lining the nasal passages, where it is taken up by the antigen-presenting cell, which presents it to the T cells. These T cells activate the B cells to release substances called IgE antibodies against the allergen. These IgE antibodies sit on the surface of the mast cells. The mast cells have granules containing chemical mediators like histamine and prostaglandins, etc. On exposure, the allergen binds to the IgE antibodies present on the mast cells, cross-linking them. This results in the release of histamine, prostaglandins, and other mediators into the surrounding tissue. These mediators cause dilation of the surrounding blood vessels and increase their permeability. This results in the nasal stuffiness, sneezing, and mucus discharge of allergic rhinitis. Antihistamines work by blocking the action of histamines at its receptors and thus decreasing the body's reaction to the allergen.
Welcome back, dear viewers. Now we're going to continue our talk with Dr. Fatuma, and today we're going to talk about the gastroenteritis in kids. Dr. Fatuma, when do you advise the parents to bring their kids to the ER or emergency room if their kids have gastroenteritis?
So if they do have repeated vomiting that's not, like I would say, responsive to oral feeds, for example, or to oral fluids, so they need to come back, they need to actually to come to the emergency department. if they do have like signs of dehydration, so what I mean about signs of dehydration, if they do have like sunken eyes, if the kid is verbal and can verbalize the thirst sensation to the parents to come right away, and if the child actually had decreased amount of wet diapers if he's an infant, or if they do have like a decrease in the urinary frequency, so they need to come back. If there is any change in the mental status too, they are too sleepy, they are unwell looking, if the child started to have like abdominal pain, they need to come into the emergency department. And in general, if the parents do have like doubts, for example, what to do and how to treat their kids, they need actually to seek medical advice for that.
Exactly, because vomiting can be actually a sign of other diseases, as we mentioned. It can be a sign of meningitis as well. So they have to be really careful with the child. But when can the parents manage their child at home?
So if, for example, if there is like 1 or 2 episodes of vomiting, again, it depends like on the child. Like if the child can take orally, for example, and I brought actually a sample of the oral rehydration solution. So this is actually kind of solution that has sugar and it has actually salt. So it's similar to the intravenous, the composition actually of the intravenous fluid that we tend actually to provide for kids who tend to have like gastroenteritis and other conditions. So if they're not able actually to take that, and if there is refusal, as I said, in drinking and
usually they will. Like usually they hate the taste of.
Do you have to force them?
Oralite.
You know, like with the need.
So it's
a syringe.
So I wouldn't actually force them, because if you force them, they would vomit.
They
They would actually vomit, so I wouldn't actually force them. So usually, like some of the children won't actually like the taste of it, or although actually it's a good taste, like it's an orange kind of taste. But some of the kids
For us maybe, but not for kids.
Yeah, some of the kids actually won't like that. So I usually tell parents you can give, for example, water, but the problem with water is just only like water. It doesn't have like the sugar, it doesn't have the important, I would say, constituents that they should actually have, because with the vomiting and with the diarrhea, they tend to lose like lots of important things. So, so in regards to the management at home, as I said, actually, if the child generally looks well, if the vomiting actually had resolved, if the abdominal pain and the diarrhea actually had resolved. But as physicians, we have actually to warn parents, because sometimes actually what happened for the gastroenteritis actually that it might last like few days, and to tell them like what to do in terms of the management. And when we, for example, discharge them, we have actually to teach the parents and to tell them when to come back to the emergency department and what to watch for at home.
Absolutely. The thing is, what are the hydrating fluids that the mother can give at home if her child is refusing the Oralite or rehydration solutions? So what do you think? What is the best way to hydrate them?
I would say this is a hard topic, like in terms of the refusal of the oral rehydration solution, because as I said, actually water won't give the benefits. It's just only like
can they give them, for example, milk or?
Milk is good.
Yeah.
Milk is good. Some of the parents actually would give like sodas, for example, or would give like juices, right? The problem actually with those sodas and juices, they do have like lots of sugars.
Yeah.
And if the child does have, for example, diarrhea, so it's going to increase the frequency of the diarrhea, and the abdominal pain actually would be more.
What about the apple juice? They always advise about apple juice usage.
The apple juice actually has lots of sugar. So I wouldn't actually recommend that.
Would you dilute it with water?
You would dilute it with water, but the thing that the problem that it won't actually, again, it won't benefit the kid. Because actually the kid had lost, as I said, lots of electrolytes during the vomiting and during the diarrhea. So in old days, there was actually a concept about BRED diet. So the BRED diet is the yogurt, the bananas, you know, like even like in our
so these cooked rice,
the traditional stuff. Exactly.
Yeah.
So it like, to be scientifically, to be honest with you, it wasn't like it's studied actually, and it didn't show that it decreases the bouts or the duration, the bouts, I would say, of the diarrhea or the vomiting, or it decreases actually the duration. So I would recommend for the children, so they eat what they want, and they can actually drink what they want, especially like if the first day actually is for example, they do have like vomiting and diarrhea, if they tolerated like the Pedialyte, so you won't actually harm them if you give like the normal food.
So if you have a child who is vomiting at home and it's an older child and he can actually tell you how he feels, but if you give him, for example, any kind of fluids and he vomits right away, how long should the mother wait until she comes to the hospital, or can she wait, for example, an hour and reintroduce the fluids?
So that's what I usually tell the parents, because once they come to the emergency department, you have actually to predict that the patient might have actually vomiting. So it doesn't mean that the patient comes to the hospital or to the clinic that the vomiting actually will be subsided completely. So if the patient tends to have like vomiting at home, I would actually say to the parents, you have to wait. If they do vomit, wait for 30 minutes to 45 minutes. And then after, start to introduce actually the oral rehydration solution very slowly. So what we do, like in the hospital, we tend to tell the parents to give them 5 milliliters every 5 minutes for 30 minutes, and then escalate as appropriate.
So you have to face the kids every 5 minutes,
Because-
face to face, yeah.
Yeah, because the thing that you don't want to actually shock the kid by giving him like too much fluids. So you have actually to see the response very slowly, and then escalate actually as appropriate. But if the child tend to have the vomiting, for example, if he does have vomiting after the
Half an hour.
this, for example, or after half hour, or if he does like repeated vomitings, they need to come right away to seek medical advice.
And then when you mean to escalate, is that 10 milliliters every 10 minutes,
Yeah,
right?
yeah,
And so,
depending on the age of the child.
all
too.
right.
Like, for example, for an infant, it's different than an older kid, for example. So it depends. Like if he's thirsty, actually, okay, so you can actually escalate, like as I said, to 10, for example. You can actually escalate to 6, 7 milliliters first of all, and then to 10. And it depends on the age, as I said.
So how would you differentiate between, gastroenteritis and food poisoning? If, for example, food poisoning can be more serious, I think, in terms it can be, of course, a bacterial cause. So how would you, explain to the mother should she differentiate at home?
It's hard for parents and for clinicians too, actually, to differentiate, like if it's food poisoning or like a gastroenteritis. So if there is, from the history, if there is a history of food intake from outdoors, and if, for example, like other family members had taken this food, and like the whole family, I would say, have the same symptoms, we would actually relate that into food poisoning. But otherwise, actually, it's hard, because some of the kids actually tend to have like gastroenteritis, and after actually like few hours, for example, or few days, the other kids actually in the family tend to have actually the same symptoms. So we usually say it's viral, unless actually if it's like lasted for long time, like more than, for example, like 5 days or more than a week. So we usually tell parents actually to come for us actually for proper management.
Okay, Dr. Fatima, the main treatment for gastroenteritis, from what I understand from you, is rehydration,
Yes.
whether oral or IV.
Yes.
What do you respond to parents if they said, I need to give my kids an antibiotic straight away to treat the gastroenteritis?
So again, that's actually like a misconception from the parents, that the antibiotic would clear the gastroenteritis. Usually what I tell them, that gastroenteritis is viral, and in most of the cases viral in origin, and virus doesn't need a treatment. Antibiotics actually would cause, as I said, actually resistance to the normal flora that's supposed actually to fight infections.
And will
normally.
increase actually diarrhea, by
That's
the way.
what I was about to say.
It worsens
Exactly.
the symptoms,
Yeah.
probably. Okay. And since gastroenteritis is actually infectious disease, and it can run actually in the family. You can see, like in the emergency room, the whole family come with gastroenteritis. How can we protect the other members of that we have from having catching the gastroenteritis?
Usually by good hygiene, like washing, for example, like hands, and not touching, like I would say, each other, and not using like the utensils actually of the other family members too. That would reduce the rate of infectivity.
Transmission.
Exactly.
Okay. That's very
Would you
good.
recommend the vaccine for the rotavirus for the gastroenteritis, or?
So for infants, you mean?
Yeah.
I would actually highly recommend that, because it was actually found that it's beneficial, and it decreases actually the bouts of gastroenteritis, especially the diarrhea symptom. Yeah.
So when will you give it, approximately?
So usually you give, like if they are infants, So usually you give it for around like 8 weeks up to 32 weeks of life.
That's very interesting talk about gastroenteritis, and we have a little bit of briefing about the facts about it. If you want to move out now to different topics, we would like to talk about choking in kids. I think this is a quite actually terrifying issue, and we would like to educate the parents to act soon and immediately if they have a child who's choked by whatever material that he has in his mouth. So can you talk to us a little bit more about choking? Dr.
Sure.
Fatima?
So choking, as you said, Dr. Anoud, so it's a terrifying actually event to the parents. And I actually had provided a picture of, I would say, most of the foreign bodies that kids tend to choke on. So we have the popcorn, we have the seeds, grapes. They tend to choke on like other stuff, I would say, but these are actually some of, I would say, examples. And as you said, actually, it's a terrifying condition. Kids tend to gag, they tend to cough, some of them actually tend to vomit. So in terms of what the parents actually need to do if their children, I would say their infant or their child actually tend to have choking. First of all, I would actually tell the parents, make sure that your child is responsive. Like, you have actually to say to the child if he's breathing for sure, are you okay? And even actually if he like shake his head, for example, or if he says, yeah, like I'm okay. So just actually try to respond into that. So in terms of dislodging or removing, I would say the foreign bodies at home, for example. So I have actually provided another slide of a maneuver that we tend to do, and it's called the Heimlich maneuver. So usually what happens is that the parent sits or stands at the back of the child, and usually with their hand, has to be actually in a fist, and the thumb actually is on top of that, and that's actually for an older kid. It has to be actually older than a year, and it's actually shown in the picture. So they have actually to apply like a thrust which is about like 45 degrees below the diaphragm, and it has to be actually 10 times. And usually kids actually tend to like dislodge, or the foreign body actually tends to be removed. But actually, if it's not the case, they should actually come right away into the emergency department. Now, for an infant, if a child is less than 1 year of age, so I'm going to actually demonstrate that. So either what the parents actually feel comfortable with, either they tend, if they actually can, they can actually put the child's face on their forearm and actually apply a back slap using actually the heel of their hands, and it has to be like fat slaps between the shoulders. So like that, so 5 times. Or if they are not comfortable, depending on the size of the child, they can actually place the child on the thigh, and they can actually do the same maneuver actually to dislodge actually this foreign body. So it's a life-saving measure, and some of the parents actually would be terrified, to be honest. And so, like, most of them won't be able actually to do that because they are really freaked out and they are really afraid of that. But it's a life-saving measure. So if they know it, it's helpful actually, and they know it. But anyways, they need actually to come to the emergency.
I think the most important advice is not to put their finger inside the mouth and try to pick.
I was about actually to say that, not to sweep, not a blind sweep, for example. Like if you see the foreign body in the mouth, you can actually remove it, but don't do a blind sweep. Because actually what's going to happen, that it might actually go into the lungs, and it might actually cause like suffocation,
which is extremely
and really,
dangerous.
respiratory compromise. Yeah.
So what do you do? What kind of things you would do, or investigation that you can offer the parents if they have a foreign body kind of stick inside the throat or, the esophagus?
So, like investigations in the hospitals, in the hospital, you mean. So in terms of the investigation, so we have actually to do like our physical examination. So we have to do a head-to-toe physical examination. And after that, we have to do an x-ray for the child and to see where is the foreign body. Usually by our physical examination we can actually locate the foreign body location, but with the x-ray that can actually really be beneficial, and depending like if the patient, for example, responsive or not, we can like intubate the kid and transfer him actually to a different facility where the thoracic surgeon can dislodge that by bronchoscopy.
Okay, this is a very nice overview and a nice advices for the parents with regard to choking. And the most common things now we would like to talk about is abusing the drugs.
Yes.
Or the cleaners at home.
Yeah.
So what to do if a child have like for the whole syrup of, for example, paracetamol or the vitamins that we have at home. So what kind of action do you have to tell the parents to do in order to save their kids?
So usually I tell, like usually they come like to the hospital after the fact, but at the scene I would actually to advise the parents, please don't freak out. So this is like number one, I would say advice, but they are freaked out anyway, so you can't actually prevent that. So usually they have to bring the child right away into the emergency department, depending on the actually medication that's been ingested.
Abused, yeah.
And then actually we can act accordingly, whether we give a fluid called activated charcoal. So it's a kind of actually a charcoaly, sugary, sweetie fluid for the kids. And it depends, as I said, on the drug.
Material used, yeah.
Exactly, on the drug or the toxins being abused. So that one actually would tend to decrease the absorption of the medication from the stomach, and it would help actually to decrease the systemic absorption and to alleviate actually side effects, as I said, depending on the medication, because some of the medications we won't actually give charcoal for, like iron, for example.
Exactly. Now, I know is it very dangerous to induce vomiting to a child?
Yes, it is very dangerous. Like for example, if I have actually a picture of some multivitamins. So multivitamins are very colorful and they are very attractive to children because of their the color. So if they, for example, like ingest iron, usually what happens to these children, they tend to have vomiting, they tend to have like abdominal pain. Some of them we tend to have like a blackish stool too. And if we tend to induce vomiting, they would have like bloody vomitus, and it might actually injure the esophagus. Later on, actually, depending on the amount and depending on the quantity of the iron being ingested, if it's, for example, toxic amount, actually, it might cause narrowing of the esophagus, and it might actually cause narrowing of the stomach itself. So I wouldn't actually I would say I wouldn't actually advise the parents to induce vomiting. They need to come right away into the emergency department, and we will act accordingly.
What about the cleaners? If they drink any of one of the cleaners that we have at the bathroom or whatever?
So so again, so most of the cleaners, like for example, for the Clorox, it's a bleach.
Yeah.
So usually what happens with the Clorox, it's usually safe, unless actually the child had drank like so much of the Clorox itself. Usually we have to keep the kids like under observation just to watch for the respiratory distress, if they tend to have like gag or vomiting, or if they tend to have abdominal pain. In terms of the detergents, they are divided into two categories. The number one category is alkali, and number one is acids, and the number two, sorry, is acids. So once the kid actually had ingested any of those materials, they need to come right away into the emergency department, because we are afraid actually that there might be an injury into the esophagus or like into the stomach.
Would you advise them to drink milk straight away?
So that's a good question, Dr. Anoud. It's debatable whether they need actually to drink milk.
Would it save? Would it do any harm?
The problem actually, it depends, as I said, actually, on the strength of the detergent itself. Like if it's very strong, so it might actually cause like an internal damage without us watching it, for example. Some of the kids actually tend to have drooling, so you know, like there are, for example, like burns, I would say, in the mouth, but you don't know like from the inside. So it depends, to be honest. I usually wouldn't recommend like giving milk for the kids, unless I make sure actually that the kids are awake, alert, and they don't have like any respiratory symptoms, I would say. Because they're afraid actually if you give milk and they do have like an internal perforation or like narrowing, for example, it can worsen the problem. It can worsen the problem. But even like in the pediatric emergency books and articles, it's debatable whether to give milk or not.
Yeah.
That's a very good question.
Exactly. That's brilliant information, doctor. And we're nearly at the end of the show. So do you have any advice, to our viewers tonight?
So in terms of the like, I would have like so many advices, but I know that I have like few minutes. Just I want to actually touch base on the bronchial asthma. Since actually we are coming and approaching actually the winter season. So I know it's a common condition that children actually tend to have. So I would actually tell parents, please, if your child needs ventilator nebulization, so please give it. Don't think actually that the child actually would tend to get used to the ventilator nebulization, because it's a misconcept that my child actually would be used to the ventilator nebulization and he will need it each time. So there is no such thing. And the other thing, if your doctor, for example, had prescribed like corticosteroids, so you need actually to give corticosteroids. They are not free of side effects. The side effects has to be discussed with your treating physician. I would recommend actually to parents, and just discuss with, for example, the clinician, like in terms of what issues you do have. For example, if you're afraid of corticosteroids, we're more than happy actually to discuss like the side effects and to follow those with you.
I get actually one question from our viewers. She has an autistic child. And as you notice that the incidence of autism has been increased nowadays. What kind of facilities do you offer for these patients, especially in the emergency room? They don't find themselves there probably, and probably they're struggling in the emergency room. What's your response with regards
So
to that?
in terms of like the autistic kids, we tend to, like in my facility, I would say we tend to have like a room, like a separate
Special
room, like an isolation room, I would say, and it has actually one bed. So we usually actually tend to keep those patients like in that room, because maybe actually the noise, like the kids actually crying, for example, or even the crowd itself actually would trigger their activity, or their trigger actually their behavior. So I would actually keep them on
So
separate
you have
rooms.
an isolation room for
Exactly.
them.
And the in regards to autism, it's a spectrum, to be honest.
Yeah.
Some of the kids actually tend to be really mildly affected, and
The
others
other
actually would be
be
moderate or highly affected.
mental.
So it depends actually on
The severity.
Exactly, on the spectrum.
So we'd like to thank you, doctor, for being here in our show, and it's amazingly important information to the parents, and it's it can be actually life-saving. So we would thank you so much for being here.
Thank you so much for having me a guest here, and it was a pleasure actually to be with you today, doctors.
Thanks again, Dr. Fatuma. I'm so happy actually to have you here, and I hope most of our viewers get the real facts about the most common disorders that our kids actually could encounter, especially during these weeks. And we would like probably to invite you probably in next shows because you have a lot of lovely informations. Thanks again, and hopefully we're gonna see you again next week. Thanks.
Thanks to our audience. Thank you so much, and we'll hopefully see you next week. I hope all the parents, got, just kept memos of all the information we said, because it's very important, and especially now the winter is coming, so you have to be really careful. Have a good night, everybody, and see you next week.